ARDS. COVID-19 ARDS. We have to know this. I mean, we will not be considered as doctors if you do not know about COVID-19 illness. Patients को भी इसके बारे में बहुत पता है. They keep on watching it on TV, Google, this, that, whatever. So you have to know COVID-19. First point, the main inflammatory cell. What are the differences from usual ARDS? Main inflammatory cell in ARDS is a neutrophil, versus in COVID-19 ARDS, the main inflammatory cell is lymphocyte. It shows the presence of mononuclear cells, that is lymphocytes and giant cells. But in दोनों में से which is the best answer? Best answer is a lymphocyte. Main inflammatory cell associated with COVID-19 ARDS is a lymphocyte. COVID-19 ARDS main inflammatory cell is lymphocyte. Next point, it is also associated with the presence of giant cells. Giant cell की क्या significance है? Giant cells, these are indicative of viral cytopathic changes. Giant cells, these are indicative of viral cytopathic changes. That is, the virus is creating havoc in the lungs. Viral cytopathic changes associated with, which are indicated by the presence of giant cells. Next point, main cytokine. Next point, main cytokine associated with COVID-19 ARDS. Non-COVID ARDS में main cytokine was interleukin 8, versus COVID-19 ARDS where the main cytokine is interleukin 6. And increased levels of interleukin 6 are associated with poor prognosis in COVID-19 illness. Increased levels of interleukin 6 are associated with poor prognosis in COVID-19 ARDS. Next point, the main cell affected in COVID-19 ARDS. Main cell affected, which is SARS-CoV-2 virus. This enters into the cell by the help of angiotensin receptors, which are present on type 2 pneumocytes. Dekho, whether you remember ACE receptors, angiotensin receptors or not, I'm totally okay with it. But you have to know that the main cell affected in type 2 in COVID-19 ARDS are type 2 pneumocytes. In non-COVID ARDS, it was type 1 pneumocyte. In neonatal ARDS, it was type 2 pneumocyte, as well as COVID-19 ARDS, it is type 2 pneumocyte. Next point. I need not even tell you that it is caused by SARS-CoV-2 virus. It is caused by the coronavirus. You know that. Incubation period is 2 to 10 days. Rarely more than 10 days. Can go up to 14 days also in less than 2% cases. But incubation period 2 to 10 days. Next point, it is associated with a high reproductive rate. What does that mean? Suppose I'm infected with COVID-19. How many people can I infect? In a closed room, I can infect everybody. But in a non-closed environment, 3 to 4 people. Those 3 to 4 people each will infect 3 to 4 people, and so on. It is an exponential increase. So COVID-19, it has a high basic reproductive rate. It has a high basic reproductive rate or R naught. Basic reproductive rate or R naught of 3 to 4. This is an exponential increase in cases. Mutated COVID-19 like Delta virus, Omicron, unka to basic reproductive rate or R naught was even higher to 5 to 6. This is non-mutated 3 to 4. Fatality rate. In the Indian subcontinent, fatality rate was slightly lower as compared to European continent. Fatality rate in India or Indian subcontinent is about 1.5 to 2% versus European countries, which was higher to 3 to 4%. This is a huge number. When 2% of the infected population, this was a huge number. This is huge fatality rate. Next point. This gets us to the risk factors. Risk factors associated with severe COVID-19 illness. You know that that is elderly patients, those who are immunosuppressed, elderly, elderly, immunosuppressed individuals, elderly, next, immunosuppressed individuals, immunosuppressed individuals, next, those having some or the other comorbidities, suffering from comorbidities like hypertension or diabetes, hypertension, diabetes, cardiac wall replacements, and so on. Hypertension, diabetes, those having cardiac wall replacement, comorbidities, those patients suffering from cancers or malignancies, cancers or malignancies. Next, any other structural damage to the lung which the patient already had with superimposed COVID-19 was poor prognosis. So these are the main risk factors associated with increased severity of COVID-19 illness. Next point. Next point. Which are the lab findings? Which are the lab findings with COVID-19? Very, very important. Main inflammatory cell in the lungs was lymphocyte. Lymphocytes are going and getting deposited in the lungs. So in peripheral smear, it is associated with lymphopenia. देखो important है. देखो, this is just a way to remember. Main inflammatory cell was lymphocytes. Peripheral smear shows lymphopenia. Lymphocytes reduce in number in peripheral blood. So I can safely say NLR, that is neutrophil to lymphocyte ratio. NLR, that is neutrophil to lymphocyte ratio increases. Lymphocytes have reduced, lymphopenia हो गया, lymphocytes have reduced. So NLR, neutrophil to lymphocyte ratio increases. NLR increases. Next, all the acute phase markers increase. That is, it is associated with increased ESR, increased CRP, because liver is affected, increased levels of bilirubin, unconjugated bilirubin is increasing, along with increased AST and ALT, along with increased levels of AST and ALT, increased AST and ALT. Next point. It is all COVID-19. It is also associated with increased levels of D-dimer, along with increased serum ferritin. All these are the acute phase reactants. All of these are the acute phase reactants which are elevated in COVID-19 illness. Main point to be noted here is procalcitonin remains normal or reduces. Important hai. Procalcitonin levels remain normal or they reduce. You will see it in pediatrics. Procalcitonin, this is also a acute phase reactant which is a marker of neonatal sepsis. Procalcitonin, it is increased in neonatal sepsis, it is increased in infections, but it has been seen that in COVID-19 illness, procalcitonin levels remain normal or reduced. These are the lab findings associated with COVID-19. Acha, tell me this also before we go further. Tell me this also. Higher mortality with COVID-19 illness is associated with which infection? BF. BF is not boyfriend, which is black fungus, that is mucormycosis. Which is the main risk factor for development of mucormycosis? Diabetes and prolonged steroid intake. So mucormycosis, this gets us to mucormycosis or black fungus. Mucormycosis or black fungus, this is very severe, associated with higher mortality. Mucormycosis or black fungus, this is associated with high mortality rates. अब देखो, just understand this. It affects the nose, rhinal. From the nose it can go to palate. नीचे आया तो palate में गया, rhinopalatin. From nose it can go to orbit, rhinoorbital, or it can go to brain, rhinocerebral. So mucormycosis, it can be rhinal, limited to the nose. नीचे आया, so rhinopalatin. ऊपर गया, rhinoorbital, or last is rhinocerebral, brain में rhinocerebral. Very obvious. Which is associated with highest mortality? Again, obvious, rhinocerebral, which has a close to 100% mortality. Rhinocerebral mucormycosis, approximately 100% mortality. It's very severe. Next point. Main risk factor. Main risk factor for development of mucormycosis being diabetes. Diabetes and patients who have received prolonged steroids. And patients who have received prolonged steroids. Prolonged steroid intake. Prolonged steroid intake. Lastly, most common organism associated with mucormycosis. This is the trick part. It is not mucor. Mucormycosis is most commonly not caused by mucor, but it is caused by Rhizopus species. It is also caused by mucor species, no doubt, no doubt. But most common organism associated with mucormycosis, most common organism being Rhizopus species. Next point. Next point. On CT scan. Next point. On CT scan. On CT, COVID-19 shows the presence of bilateral GGOs. I guess for radiologist, previous 1.5 year, GGOs was the most common finding. It shows the presence of bilateral ground glass opacities. It shows the presence of bilateral GGOs. Bilateral GGOs, that is, it is associated with presence of bilateral ground glass opacities in the lung. Next, investigation of choice. IOC, investigation of choice for COVID-19 illness is RRT-PCR. Investigation of choice being RRT-PCR, that is real-time reverse transcriptase PCR. Investigation of choice being RRT-PCR, real-time reverse transcriptase PCR, RRT-PCR. This is COVID-19 illness. This is COVID-19 illness. So before we go further, let us quickly have a look. Let us quickly have a look at COVID-19, the microscopy, and few questions associated. Dekho, the minute I see this, I know it's a lung biopsy. These are the alveoli with alveolar septa and air inside it. So I know that this is a lung biopsy. Or the examiner can also tell you that he has done a lung biopsy. Fair enough. Showing the presence of hyaline membrane deposition in alveoli. देखो ये कितना thick है ना. This is thick pink deposit. That is hyaline membrane deposition. This is the hyaline membrane deposition in alveoli. Hyaline membrane deposition in alveoli, making this as a case of ARDS, acute respiratory distress syndrome. Now look at the insert image. Look at the inflammatory cells. Inflammatory cells, these are mononuclear cells, mainly lymphocytes. Inflammation is mainly by mononuclear cells. In non-COVID ARDS, inflammation was by neutrophils. Versus COVID-19, it is by mononuclear cells. And it is also associated with the presence of giant cells, cells with multiple nuclei. Look at this and this. Cells with multiple nuclei. These are the giant cells. These are the giant cells which are indicative of viral cytopathic changes, making this as a microscopy of COVID-19 ARDS. Making this as COVID-19 ARDS. देखो, hyaline membrane deposition तो दोनों में मिला. Whether it was ARDS or non-COVID or COVID ARDS, hyaline membrane deposition is the diagnostic hallmark of ARDS. वो तो मिलना ही है. But in non-COVID ARDS, the main inflammatory cell is neutrophil. Versus COVID-19 ARDS, where the inflammatory cell are mononuclear cells and giant cells. Next point. Tell me the answer. All of the following are documented modes of transmission except it is by droplets, eye fluid, tears. Tears are known to transmit COVID-19. Tears too. Aerosol. Blood is not. It is not transmitted by the parenteral route. So all are documented modes of transmission except blood. Next question. All of the following are true about COVID-19 except mean incubation period is 2 to 7 days. Fatality. Indian subcontinent is 1.5 to 2. Western is higher, 4 to 7. Fair enough. Around one third people had contact with wildlife. नहीं बचे. Majority of the people get infected by asymptomatic carriers. The most common route of transmission, or the most common person who is transmitting the illness, are asymptomatic carriers, not wildlife, and that too one third, not at all. So option C was wrong. Procalcitonin is normal or reduced, it is not elevated. Option 4 was right. So answer was 3. Answer was 3. Next question. Least recommended sample for testing COVID-19. देखो, we can do nasal swab, throat swab, bronchoalveolar lavage, and bronchoscopy. All 4 can be performed. But least recommended is bronchoscopy. Least recommended is bronchoscopy. Why? Because it leads to formation of aerosols. It leads to generation or formation of aerosols, which is harmful for the ENT specialist doing it. We do not want the doctors getting infected. Why? Because doctors will eat food in doctor's mess and they will infect all the doctors in the hospital. So least recommended sample is bronchoscopy, because it leads to generation of aerosols, which have high infectivity in COVID-19. Next, seen in COVID-19 is all except. It is associated with increased interleukin-6 levels. Increased levels of interleukin-6 are poor prognosis in COVID-19 illness. They are poor prognosis. You know that. Ferritin increases, procalcitonin reduces. Agreed? D-dimers increase. They do not reduce. They increase. So seen in COVID-19 illness is all except reduced D-dimers. D-dimers increase in COVID-19 illness. So this was about COVID-19. This was about COVID-19. And lastly, before we wrap up the discussion on COVID-19 ARDS, let us have a look at the CT finding also. It shows large ground glass opacities in bilateral lung, bilateral GGOs. Dekho, all these. They look ground glass in appearance. They look ground glass. Bilateral ground glass opacities. Bilateral ground glass opacities in the lung, as is seen on CT. They look ground glass in appearance. That is COVID-19 ARDS. That is COVID-19 ARDS. Done, Bachi. So this takes care of your miscellaneous topics in the lung. Atelectasis, pulmonary edema, which can be cardiogenic versus non-cardiogenic. Cardiogenic pulmonary edema was associated with left-sided heart failure versus non-cardiogenic, which was without heart failure. Non-cardiogenic pulmonary edema was ARDS. We divided ARDS into non-COVID ARDS versus COVID ARDS. So this finishes miscellaneous topics. Done.